The kidneys are a pair of bean-shaped organs on either side of the spine below the ribs. Each kidney is about 4 to 5 inches long, roughly the size of a large fist. Kidneys remove waste, control body's fluid balance, and keep the right levels of electrolytes. Kidney failure occurs when the kidneys can no longer function on their own. Guys, welcome back to yet another episode of Med-Surg Mentor, and today let's see the condition renal failure. Renal failure is a condition in which one or both kidneys stop working and are not able to remove waste and extra water from the blood. Common etiologies of renal failure are type 1 or type 2 diabetes, high blood pressure, recurrent kidney infections, glomerulonephritis, prolonged obstruction of the urinary tract, polycystic kidney disease, and vesicoureteral reflux. Etiologies of renal failure are classified into three, and they are prerenal, renal, and postrenal causes. Prerenal causes occurs due to decreased renal perfusion resulting in decrease in the glomerular filtration. Common causes are hypotension, burns, heart failure, and hemorrhage. Examples of intrarenal or renal causes are acute tubular necrosis, glomerulonephritis, and interstitial nephritis. This occurs due to prolonged or severe renal hypoperfusion or reduced blood flow. Postrenal causes of renal failure results from obstruction of the collecting system from conditions like benign prostatic hypertrophy, carcinoma, calculus, and strictures. Major risk factors of renal failure are conditions like diabetes mellitus, high blood pressure, cardiovascular diseases, smoking, obesity, being Black, Native American or Asian American, family history of kidney disease, abnormal kidney structure, older age, and frequent use of medications that can damage the kidneys. Now let's move on to the pathophysiology of renal failure. Due to etiological factors like diabetes mellitus, there is diminished renal reserve followed by loss of kidney function. This results in disturbed glomerular and tubular function and increased metabolic waste accumulation. Gradually, there is sodium and water retention, resulting in life-threatening complications like pulmonary edema. There are two types of renal failure, and they are acute and chronic renal failure. Acute renal failure develops within hours or days and is mostly reversible. Common causes are trauma, intoxications, multi-organ failure, and infections. Whereas chronic renal failure develops over years and is irreversible at the later stage. Common causes are high blood pressure, diabetes mellitus, chronic bacterial inflammation, and autoimmune diseases. Clinical features of renal failure are decreased urine output, nausea, vomiting, loss of appetite, fatigue and weakness, sleep problems, decreased mental sharpness, muscle cramps, swelling of feet and ankles, dry itchy skin, high blood pressure, shortness of breath, and chest pain. Next is diagnostic measures of renal failure. Commonly used blood tests are serum creatinine and blood urea nitrogen. Other tests are urine tests, ultrasound, MRI, and kidney biopsy. Commonly seen complications of renal failure are fluid retention, high blood pressure, pulmonary edema, irreversible kidney damage, anemia, heart disease, increased risk of bone fractures, pericarditis, hyperkalemia, decreased sex drive and fertility, decreased immune response, difficulty in concentrating, personality changes, and seizures. Next is medical management of renal failure. They are high blood pressure medications such as angiotensin converting enzyme inhibitors or angiotensin II receptor blockers, drugs to relieve swelling like diuretics, drugs to treat anemia such as hormone erythropoietin, drugs to lower cholesterol levels such as statins, drugs to protect bones like calcium and vitamin D supplements, and a low protein diet. Next, management of renal failure is dialysis. There are mainly two types of dialysis, and they are hemodialysis and peritoneal dialysis. Dialysis is the process of removing excess water, solutes and toxins from blood in people whose kidneys can no longer perform these functions naturally. In hemodialysis, blood is pumped out of the body to an artificial kidney machine and returned to body by tubes after filtration. Whereas in peritoneal dialysis, the peritoneum in a person's abdomen is used as a membrane through which fluids and dissolved substances are exchanged with the blood. Surgical management of renal failure is kidney transplantation. And a kidney transplantation is a surgery done to replace a diseased kidney with a healthy kidney from a donor. The kidney may come from a deceased organ donor or from a living donor. Preventive measures of renal failure are: maintain a healthy weight, do not smoke, avoid use of alcohol, avoid taking too many painkillers for a long time, monitor kidney function, keep blood sugar levels and blood pressures under control, limiting foods high in protein and sodium, avoid products with added salt, choose lower potassium foods, and limit the amount of processed foods. Important nursing diagnoses for patients with renal failure are: risk for decreased cardiac output related to myocardial workload, deficient knowledge related to cognitive limitation, risk for arrhythmia related to potassium imbalance, excess fluid volume related to impaired renal function, acute pain related to the kidney damage, impaired renal perfusion related to improper functioning of the nephrons, impaired urinary elimination related to reduced kidney function, imbalanced nutrition less than body requirement related to anorexia and nausea, and activity intolerance related to pain and weakness. Nursing cares for patients with renal failure are: auscultate heart and lung sounds, assess vital signs, oxygen saturation and body weight, prepare the patient for dialysis, restrict sodium and fluid intake if indicated, assist with pericardiocentesis as indicated, review lab values like blood urea nitrogen, creatinine and serum electrolytes, weigh the client and monitor intake output, administer drugs and watch for complications, ensure skin care and avoid skin breakdowns, administer oxygen if ordered, and ensure psychological support. Today we have seen the condition renal failure. Renal failure is a condition in which kidneys are unable to filter waste products from blood. Common causes are high blood pressure and diabetes mellitus. Etiologies can be classified into prerenal, renal, and postrenal causes. Major treatment modalities are pharmacological management, dialysis, and kidney transplantation. Hope this video was informative. If you like this video, give a thumbs up, share with your friends, and make sure to subscribe to my channel. Thank you.